Welcome to my channel, Healing with Dr. Anthony. I'm truly glad you're here today because if you're over 55, this conversation could protect your brain, your heart, and possibly even your life. Stroke does not usually arrive with loud warnings. It builds silently through daily habits that feel normal and harmless. Many people believe strokes are sudden events, but in reality, the damage begins years earlier inside the blood vessels. Inflammation, rising pressure, thickened blood, and stiff arteries slowly weaken the brain's lifeline. Today we will talk about one common food doctors warn seniors about, not to scare you, but to give you awareness and control over your health. Today, we are going to talk about one specific food that doctors increasingly warn seniors about, not because it is evil, but because after a certain age, the body no longer handles it the same way. This food is common, familiar, and often eaten with good intentions. Yet for people over 55, it may quietly increase stroke risk when consumed regularly. My goal today is not to scare you, but to give you clarity, control, and practical knowledge so you can make informed choices and protect your health as you age. As we get older, our blood vessels naturally change. The flexible, elastic arteries we had in our youth slowly become stiffer. The inner lining of the arteries, called the endothelium, becomes more sensitive to inflammation, sugar spikes, and chemical stress. This means foods that once caused no problem can suddenly start triggering damage. Blood pressure becomes easier to elevate. Cholesterol particles become more likely to stick to artery walls. Blood itself can become slightly thicker, flowing less smoothly to the brain. When this happens repeatedly, day after day, the risk of clots increases. A stroke is often the final outcome of years of small, unnoticed injuries to the vascular system. That's why doctors focus so much on daily diet choices after 55. Not because one meal causes a stroke overnight, but because repeated exposure can slowly push the body toward danger. That slow progression is what makes stroke so dangerous and so difficult to detect before serious damage occurs. The food doctors warn about most often in seniors is high-sodium preserved and pickled foods, especially vegetables that are heavily salted or processed. Many people are surprised by this because vegetables are generally associated with good health. However, the problem is not the vegetable itself. The problem is the salt load, the preservatives, and the way these foods affect aging blood vessels. Pickled vegetables, salted greens, preserved vegetable mixes, and packaged vegetable sides often contain extremely high sodium levels. After 55, excess sodium becomes far more dangerous than most people realize. It causes the body to retain water, increasing blood volume. This extra volume raises blood pressure, putting constant stress on artery walls. Over time, this stress leads to micro tears in blood vessels, making them more vulnerable to clot formation and rupture inside the brain. Another hidden danger of these foods is how they affect nighttime blood pressure. Many seniors experience what doctors call non-dipping blood pressure. Meaning blood pressure, meaning their blood pressure does not drop properly during sleep. Eating high-sodium foods in the afternoon or evening worsens this effect. Blood pressure stays elevated overnight, when the brain should be resting and repairing itself. This is one reason strokes often occur in the early morning hours. The arteries are already under strain, the blood is thicker from mild dehydration, and pressure spikes can push fragile vessels past their limit. Doctors consistently warn that repeated high-sodium intake can silently push seniors toward this danger zone. There is also the issue of inflammation. Preserved and pickled foods often contain compounds that irritate the gut lining when consumed in excess. After 55, gut health plays a major role in vascular health. An inflamed gut releases inflammatory markers into the bloodstream. These markers damage the inner lining of arteries, making it easier for cholesterol plaques to form. When plaques become unstable, they can rupture and form clots that travel directly to the brain. This is one of the most common mechanisms behind ischemic stroke. The frightening part is that this process produces no pain until it reaches a critical point. Doctors also pay close attention to how these foods affect potassium balance. Fresh vegetables are rich in potassium, which helps relax blood vessels and counteract sodium. But preserved vegetables often lose potassium while retaining massive amounts of salt. This creates a dangerous imbalance. Low potassium combined with high sodium makes blood vessels constrict more easily. Constricted vessels increase resistance, forcing the heart to pump harder. Over time, this constant strain raises stroke risk significantly. This is why doctors don't just say eat vegetables, they say eat fresh vegetables, especially after 55. Another factor many people overlook is how taste sensitivity changes with age. As taste buds dull, people often crave stronger flavors. This leads to adding more salt, choosing pickled foods, or eating preserved vegetables more frequently. What feels like a small indulgence can become a daily habit. Doctors see this pattern repeatedly in stroke patients. When they review diet histories, they often find regular consumption of high-sodium preserved foods, combined with other risk factors like mild hypertension, stress, or low physical activity. No single factor causes the stroke, but together they create the perfect conditions for it to happen. This does not mean you must live in fear or eliminate joy from your meals. It means learning how to adjust wisely. Doctors recommend limiting preserved and pickled vegetables to occasional use, not daily consumption. They strongly encourage switching to fresh, lightly cooked or steamed vegetables seasoned with herbs, garlic, lemon, or healthy oils instead of salt. These alternatives support blood vessel flexibility and reduce inflammation. Hydration also plays a critical role. High-sodium foods pull water out of cells and into the bloodstream, thickening the blood. Thicker blood moves more slowly and clots more easily. Seniors are already at higher risk of dehydration due to reduced thirst signals. Combining dehydration with salty foods is especially dangerous. Doctors advise drinking water consistently throughout the day, especially if any salty foods are consumed. Proper hydration helps keep blood flowing smoothly to the brain. Let's also talk about timing. Eating high-sodium foods late in the day is particularly risky. Doctors suggest keeping dinner lighter and lower in salt. This allows blood pressure to drop naturally at night. Giving blood vessels time to rest helps protect the brain. Seniors who adopt this habit often see improvements in morning blood pressure readings and overall vascular health. Stress is another silent contributor. Salt sensitivity increases under stress. When stress hormones rise, the body holds onto sodium more aggressively. This is why emotional eating of salty foods can be especially harmful after 55. Doctors encourage mindful eating, slower meals, and stress reduction practices like walking, breathing exercises, or light stretching. These habits work together with diet to protect the brain. It's important to remember that strokes are not just about survival. Many stroke survivors live with long-term disability, speech difficulties, memory problems, or loss of independence. Doctors emphasize prevention because the cost of a stroke is not measured only in hospital bills, but in quality of life. The good news is that dietary changes made even later in life can significantly reduce risk. Blood vessels respond positively to reduced salt, improved hydration, and anti-inflammatory foods within weeks. If you are over 55, take a moment to look honestly at your daily meals. Ask yourself how often preserved or pickled vegetables appear on your plate. Ask when you eat them and how much salt is involved. Awareness is the first step toward protection. You don't need perfection. You need consistency. Your brain depends on a steady, clean flow of blood every second of every day. Every choice you make either supports that flow or works against it. Doctors don't warn seniors about food to take pleasure away, but to help you stay active, independent, and mentally sharp for as long as possible. Aging does not mean giving up control. It means using wisdom to protect what matters most. If you found this information helpful, please take a moment to like this video, because it helps more seniors find reliable health guidance. Subscribe to Healing with Dr. Anthony for more practical, science-backed advice on staying strong, clear-minded, and healthy after 55. And remember, small changes today can prevent life-altering events tomorrow. Take care of your arteries, and they will take care of you.